Hello, I'm Dr. David Richardson. I'm a cataract and glaucoma surgeon in Southern California. And today I'd like to talk about the topical carbonic anhydrase inhibitors. All right, let's go. So the carbonic anhydrase inhibitor class I've discussed in detail in a prior video. In addition to the oral medications, the ones taken by mouth, there are two medications available here in the United States that are FDA approved in this class that are eye drop medications. Now, these medications are dorzolamide, which is the first one to be approved about 20 years ago, and brinzolamide. Now, dorzolamide goes by the brand name Trusopt. Brinzolamide goes by the brand name Azopt. Both of these are eye drops that are prescribed to be used at least twice a day, although the initial pharmacologic studies suggested that they would be most effective 3 times a day. Now, 3 times a day, it's almost impossible for most people to get the drops in 3 times a day. So the thinking and the hope among ophthalmologists and their patients is that twice a day will be sufficient. Now, these drops are also available in what are called fixed combinations. So in the case of dorzolamide, it's available in a brand named Cosopt, which is dorzolamide plus timolol. And that's also available preservative-free, and we may talk about that in a little while. And I've talked about the advantages of preservative-free eye drops elsewhere. The other fixed combinations include Simbrinza, which is brinzolamide plus brimonidine. So the advantage of that particular fixed combination is that it has no beta blocker in it, so it's less likely to have a systemic side effect than would Cosopt. And then there are various combinations of dorzolamide and other classes of medications available through compounding pharmacies such as Imprimis, and some of those are even preservative-free. Now, this class of medications, as with the oral carbonic anhydrase inhibitors, works to decrease the amount of aqueous, the amount of fluid that's produced in the eye. So again, it does not affect the actual point that is problematic in glaucoma, but it does work by decreasing fluid production, so that then, on balance, results in decreased pressure in the eye, which helps protect the optic nerve from glaucomatous damage. Now, this class of medications, when taken in the eye drop form, really only has a couple of common side effects. The most common side effect is that it stings when you put it in the eye. And dorzolamide tends to sting a bit more than brinzolamide, but they both sting a little bit. They can both give you a little bitter taste in the back of the throat, which you can reduce the incidence of bitter taste by punctal occlusion, either with a finger or with a balled up tissue. The systemic side effects that the carbonic anhydrase inhibitor class has associated with the oral medications are all potentially something that could happen even with the eye drops, but in practice they're very, very unlikely. Now, how well does this class of medications work? As discussed with the oral carbonic anhydrase inhibitors, that class works really, really well when taken by mouth. Unfortunately, when used as an eye drop, it's one of the least effective classes. For whatever reason, it really just doesn't seem to saturate the receptors sufficiently to provide good intraocular pressure lowering. So for this reason, it is hardly ever prescribed as a first-line therapy. It's almost always an add-on to either timolol or the prostaglandin analogs. Often it's the third to be used after, say, brimonidine, the alpha-agonist class. So a couple more things I want to discuss now that I've arrived at the office here is, and I'm casual today because it's Saturday. Yeah, I'm still coming into the office, but I'm not seeing anybody, just paperwork. So the cost of these medications. So you would think, okay, well, it's not that effective of a class. It's often added on to other drops. It's very commonly in a fixed combination agent because, again, on its own, it's not that effective. So it must not be that expensive, right? Well, dorzolamide is available generically, and that's quite often covered. Unfortunately, this is one of those times where the generic just cannot be counted on to be as effective as the brand. Whereas other classes of glaucoma medications, such as the prostaglandin analog class, the generic latanoprost seems to be just as effective as the branded Zalatan. With dorzolamide, the generics are all over the place. You can have generic dorzolamide that has essentially no effect all the way up to as good as the brand. And the problem is that pharmacies will often swap the brands of generics, so even generics are made by different manufacturers. They will swap the manufacturer according to pharmacy benefit plan or supplier they have. And so I've had patients who are doing just fine on the generics, and then all of a sudden their pressure rises, and it turns out that the pharmacy has swapped them out to different manufacturers. So as much as possible, I recommend avoiding the generic dorzolamide, which unfortunately means that even though this class is 20 years old, if you're taking the brand and your insurance doesn't cover it, it can be quite expensive. So one of these problems we run into with almost all medications now is there's no correlation between the time it's been available and the price of the medication. So anyway, that's some of the basics of this class of medication, and it's a shorter video because I've already discussed most of the class already with the oral carbonic anhydrase inhibitors. But hopefully you found this useful, because it's a very commonly prescribed class for those who have moderate to advanced glaucoma that is not controlled on a single or double agent. All right, well, thank you. Take care, and we'll be chatting again shortly, I'm sure.